Welcome to the deep dive. Today, we are going right into understanding conduct disorder in children, specifically how it shows up in the day-to-day interactions between parents and their kids. You shared a really comprehensive piece of research with us, and, well, our mission is to pull out the most crucial insights from it.
Exactly. And when we talk about conduct disorder or, CD, we're not just referring to the occasional bad day. The research defines it as a persistent pattern of behaviors that are antisocial, things like being aggressive, having frequent and intense temper outbursts, and, well, not following rules.
Right.
This pattern has to last for at least 6 months and happen more often than you'd expect for a child's age. What's really interesting is that this isn't just a general description. It comes from years of research using what are called factor analytic studies.
Factor analytic studies.
Yeah, think of those as statistical tools that help researchers identify groups of behaviors that tend to occur together, showing that this cluster of antisocial actions is distinct from other issues like being anxious or withdrawn.
Right. So it's a recognized pattern based on data, not just a, label.
Yeah.
And it's a significant issue, isn't it? The research makes it clear that CD is quite common and it can be really difficult to manage.
Yeah, definitely.
Sadly, it's also linked to problems at school, within the family, and can even predict challenges with things like delinquency and overall well-being later in life.
Yeah.
That's why getting a handle on what's driving it is so important.
Absolutely. But pinning down what CD is and how it develops isn't always straightforward. You might hear different terms used: coercive behavior, oppositional behavior, even just generally antisocial, often referring to similar underlying issues.
Uh-huh.
The paper you shared also touches on how different diagnostic systems, like the old DSM-IV-R, tried to break CD down into specific subtypes. However, the research we're focusing on here points out that there wasn't always strong evidence, empirical support for those particular categories.
Okay.
Plus, the systems sometimes missed younger children who are already struggling significantly with behavior at home.
Okay, so to keep things clear and aligned with the research on how parents and children interact, especially with younger kids, we're going to focus on that empirically derived definition, the one that comes from those factor analytic studies showing a clear cluster of behaviors.
Precisely. And it's important to remember that how these behaviors look changes as kids develop. Early on, CD often manifests in how a child interacts with their parents and siblings.
Right, and the family first.
Yeah. As they get older, it can extend to school and other social situations. The research highlights that what's considered problematic depends a lot on the child's age. A 2-year-old having a tantrum is different from a 5-year-old doing it regularly.
Big difference, yeah.
But a key characteristic of CD is that these challenging behaviors tend to persist over time, sometimes starting even in the preschool years.
Now, while we're really diving deep into family interaction today, research does acknowledge that there are many pieces to the puzzle when it comes to behavioral disorders in children.
For sure.
Things like the school environment, how a child learns, their basic temperament or inborn style, and even their genetics all play a role. But as the paper outlines, our focus for this particular deep dive is primarily on those parent-child dynamics.
That's right. And this brings up a really crucial point in this type of research: figuring out what causes what. Just because we see a connection between how parents interact with their child and that child's behavior doesn't automatically mean the parent's actions are causing the child's behavior.
Or the other way around.
Exactly, or the other way around. The paper references some really foundational work, Bell and Harper back in the late 70s, which emphasized that children also have a significant impact on their parents, and that it's often a complex back-and-forth influence.
Okay, let's dig into this idea of child effects more, starting with temperament. How does the research show that a child's natural way of behaving can shape those interactions with their parents?
Well, temperament is essentially the innate behavioral style a child is born with, their typical way of reacting to and engaging with the world. Landmark studies, like the one by Thomas and his colleagues in the late 60s, demonstrated that these differences in temperament can be observed very early in infancy.
Really early. Why?
Yeah, and that many of these traits tend to be quite stable as the child grows. Now, here's where it becomes really interesting for understanding CD. A study by Lee and Bates in the mid-'80s looked at something they called difficultness in babies.
Difficultness, okay.
This included things like being frequently moody, fussy, crying a lot, and having very intense emotional reactions. What they found was that infants who were rated as more difficult at 6 and 12 months were significantly more likely to exhibit problem behaviors later in childhood.
So we're talking about these early indicators of a more challenging temperament. potentially predicting things like increased conflict with parents when the child is 2 or 3, and even a higher likelihood of conduct disorder much later, like in elementary
I
school.
see.
That really suggests that the child's inherent style can kind of set the stage for more strained interactions with their caregivers.
Exactly. Those infants who were identified as difficult were more prone to engaging in conflictual interactions with their mothers, even at a young age. This strongly implies that the child's inborn temperament can indeed influence how parents behave towards them.
Hmm.
It's a really important reminder, as the paper emphasizes, that when we see a relationship between parent and child behavior, we need to be very careful about assuming that the parent's actions are always the starting point. The child brings our own set of characteristics to the interaction right from the beginning.
That makes a lot of sense. Now, the research also broadens its scope to look at the wider social context surrounding the family. How do factors outside that immediate parent-child relationship play a role in the development of CD?
This is where we sort of step back and look at the bigger picture. The paper makes a useful distinction between two main types of research here. Epidemiological studies, which involve looking at large representative samples of the general population.
Okay, big population studies.
Right. And clinical studies, which often focus on specific groups, like children who have been referred to clinics because of behavioral problems. Both types of studies have provided valuable insights into how social factors can impact parent-child interaction and contribute to CD.
And one of the really well-known examples of this is the work of Rutter and his colleagues in the Isle of Wight and inner-city London back in the 1970s. What were the key findings from those studies?
Those were truly landmark studies in the field. They consistently found a strong link between what they termed family adversity factors, things like living in poor housing conditions, unemployment within the family, significant marital problems, a history of criminal behavior in the parents, and maternal mental health issues.
Whole cluster of things.
Exactly, a cluster and the occurrence of conduct disorder in children. What was particularly striking was that when a child experienced multiple of these stressors at the same time, the risk of developing CD didn't just add up, it seemed to multiply, suggesting a cumulative impact of these hardships.
Wow, so it compounds.
It really does. Interestingly, the higher rates of CD observed in inner-city London compared to the Isle of Wight could largely be accounted for by the greater prevalence of these very family adversity factors in the urban environment. This highlights that these challenges often cluster together and can significantly amplify a child's risk.
So a more challenging social and economic environment seems to create a greater vulnerability. But what about younger children, those in preschool years? Does the research show similar connections?
Yes, it does. Studies that focused on younger children, like the work by Richmond and colleagues in London and Barron and Earls in the U.S., also found associations between early signs of CD and factors such as ongoing marital conflict, maternal depression, and inadequate housing.
Okay, similar factors.
Yeah, but what's particularly insightful is that Richmond's study also delved into the specifics of how mothers were interacting with their children and their overall attitudes. They found that things like how often the mother criticized her child, her general irritability, and a lack of warmth in the relationship were actually more strongly linked to the child's CD than those broader social factors like socioeconomic status or housing quality.
Huh. So the interaction itself was a stronger predictor.
It seemed to be, yes. This really starts to point towards the crucial role of the direct day-to-day interactions between parent and child.
That's a really important distinction. It brings us back to that immediate relationship. Now, the paper also dedicates attention to the specific influences of maternal depression and social isolation. What have we learned about how these factors might connect with conduct disorder in children?
Well, the connection between maternal depression and conduct disorder in children, particularly in families who are seeking help at clinics, is a well-established finding in the research. However, there's a really important question that arises. Could it be that mothers who are depressed are simply more likely to view their children's behavior in a negative light, leading to more referrals to clinics and higher ratings of problem behavior?
Right, the perception issue.
Exactly. In other words, is it the actual behavior or the mother's perception of it that's driving the reported issues?
That's a critical point about potential biases in how we collect this information.
Yeah.
So how have researchers tried to account for that possibility?
To address that, several studies have used methods to assess the child's behavior that don't rely solely on the mother's report. This includes direct observations of families interacting in their homes, as well as reports from other sources like teachers and fathers.
Getting multiple perspectives.
Exactly. The study by Webster, Stratton, and Hammond in the late 80s is a good example of this approach. They found that based on these independent reports from teachers and fathers, children of depressed mothers were indeed more likely to exhibit difficult behavior.
Okay, so there is more difficult behavior.
Yes, but, and this is key, the depressed mothers themselves still rated their children as being significantly more difficult than did the fathers and teachers.
Ah,
This suggests that while the children of depressed mothers may genuinely be facing more behavioral challenges, the mother's emotional state does also influence how she perceives and reports on her child's behavior. So it seems to be a combination of both factors.
so it's a mix of the child's actual behavior and the mother's emotional lens through which she views it.
Yeah.
What about this concept of insular mothers that the paper discusses?
Right. Dumont and Waller, in their research with families who were seeking clinical help for their children's behavior, identified a group of mothers they described as insular. These were mothers who reported having very few enjoyable social connections with friends or community members.
Kind of isolated.
Yes, but who had a relatively high level of contact with formal helping agencies or other relatives. They found that these insular mothers often struggled more to implement effective parenting strategies that were taught in therapy, and their children tended to show higher rates of negative behavior when observed in their homes.
It paints a picture of mothers who might be feeling more alone and whose social interactions, even when they do occur, might be more focused on getting help for problems rather than on positive support.
That seems to be the idea, yes.
How might these broader social factors like maternal depression or social isolation actually translate into changes in the direct interactions between a parent and their child? What are the proposed pathways?
Well, a prominent researcher in this area, G.R. Patterson, developed a model that suggests that experiencing chronic adversity or significant life stressors can negatively impact a mother's mood, making her more irritable, withdrawn, or feel hopeless.
Okay, the stress takes a toll.
Right. This, in turn, can lead to inconsistencies and ineffectiveness in her parenting. Things like not monitoring the child's behavior closely, being lax with discipline at times and overly harsh at others, and struggling to encourage positive behaviors. Over time, this breakdown in consistent and positive parenting can then directly contribute to the development and maintenance of problem behavior in the child.
So it's like a chain of events where external pressures affect the parent's emotional well-being and their ability to parent effectively, which then impacts the child's behavior.
That's the model, yes.
And the research does seem to support this, with observations of depressed mothers often being described as more irritable, less consistent in their responses, and less responsive to their children's needs.
Yes, but the paper also points out that the influence isn't always in one direction. A child's own temperament and behavior can also affect the mother's mood and her parenting practices, creating a kind of ongoing cycle of reciprocal influence.
Right, that back and forth again.
Exactly. Furthermore, maternal depression itself isn't a uniform experience. Some mothers might primarily exhibit agitation and irritability, while others might be more withdrawn and less engaged. And these different ways that depression manifests can have different effects on the child's behavior.
That makes sense. An irritable parent might provoke more acting out, whereas a parent who is withdrawn might lead to different kinds of challenges. And the research brings up some really interesting and nuanced findings here, doesn't it?
It really does.
Some studies even found that children exhibited less difficult behavior when their mothers expressed more sadness or withdrawal.
Exactly. One study by Hops and his colleagues actually found that when mothers expressed sadness or self-deprecating remarks, they were followed by less irritability and rudeness from both the children and the fathers in the family.
Huh, that's counterintuitive.
It is. It suggests that the relationship between maternal depression and child behavior isn't always straightforward and can depend on the specific ways depression manifests. Dumas and his team even found that children with CD, whose mothers were depressed, actually showed more difficult behavior specifically towards their fathers, which is a rather unexpected finding.
Wow.
It highlights the complexity of these family dynamics.
It really seems like children might be discerning about when and with whom they exhibit their problem behaviors. What about the impact of social isolation, that feeling of being insular on these direct interactions at home?
Dumas' 1986 study on those insular mothers provided some really intriguing insights. He found that on days when these mothers reported having unpleasant social encounters outside of the home, they were more likely to behave irritably towards their children later that day. And importantly, this seemed to be independent of the child's behavior at the time. This offers more direct evidence for the idea that stress experienced by the mother in her external social interactions can directly translate into more negative behavior towards her child at home.
Spilling over, essentially.
Really kind of like that, yeah. However, as the paper rightly notes, this study did rely on the mother's own reports of their social encounters, and those reports could potentially be influenced by their overall mood.
Right, that perception issue again. And then there's the significant family stressor of divorce. What does the research tell us about how that impacts parent-child interaction and the likelihood of CD?
Hetherington and her colleagues conducted a really important longitudinal study looking at families after divorce. They found that following a divorce, mothers tended to be less consistently affectionate, more inconsistent in their discipline, and generally less effective in their parenting, particularly with their sons.
Especially with sons. Interesting.
Yeah. This shift in parenting was often accompanied by an increase in conduct problems in the children, again, with the effects being more pronounced in boys. Their use of statistical techniques called cross-lagged correlations suggested that the mother's increased negativity after the divorce might be a stronger predictor of later behavior problems in the child than the other way around.
Okay.
However, as the paper cautions, drawing firm causal conclusions from this type of analysis has its limitations.
And the research also points out that some of the difficulties we see in divorced families might actually originate in the period before the divorce, in the midst of high marital conflict.
That's a really key point.
The Jenkins and Smith study on intact families who were experiencing a lot of marital discord found strong correlations between the level of parental conflict, poor parenting practices, and the presence of CD in their children. This suggests that the conflict itself might be a really key factor, regardless of whether the parents ultimately decide to separate.
Precisely. These studies really underscore the importance of understanding the specific mechanisms through which these broader social and familial factors ultimately affect the very detailed ways in which parents and children interact with each other on a daily basis.
Right.
And that brings us to the core of our discussion. What do those direct interactions actually look like in families where a child has conduct disorder?
Let's delve into that now, focusing first on the role of conflict. The paper highlights the very influential work of G.R. Patterson and his social learning theory. What are the central ideas of his perspective?
Patterson's social learning theory in this context really emphasizes the idea that problem behavior within a family is often learned and maintained through a combination of modeling children learning by observing others and, crucially, through the consequences of their behavior during those heated, quarrelsome interactions.
Okay, learning through interaction.
Yes. He argued that these problem behaviors often have the effect of coercing reaction from the environment, and that those reactions can often inadvertently reinforce the very behavior they are trying to stop, particularly through a process called negative reinforcement. Over time, this can lead to the development of habitual cycles of unpleasant interaction within the family.
And Patterson's research has been characterized by a very detailed observational approach, right? He developed specific systems for coding and analyzing how families interact in their own homes.
Yes, his research group developed a very detailed observational coding system where trained observers would record specific behaviors within the family, like every 6 seconds. There's a strong focus on identifying negative and controlling behaviors exhibited by all family members.
Wow, 6 seconds. That's granular.
Very much so. By then analyzing the sequences of these behaviors, they could examine the immediate triggers and consequences of problem behavior. They would then compare these patterns in families with children who had been referred for conduct disorder to those in matched families where the children did not have these problems.
And what were some of the key differences in those interaction patterns that they observed?
Well, perhaps not surprisingly, they found that children with CD exhibited much higher rates of aversive behavior. But what was also notable was that their parents and siblings also showed increased levels of negative behavior, supporting the idea that the whole family system is often affected.
So it's not just the child.
No, definitely not. These negative behaviors in CD families tended to occur in more frequent and longer bursts of conflict. Mothers of children with CD were also more likely to react negatively to these outbursts, but their attempts to discipline things like nagging, shouting, or making threats often proved to be ineffective in actually stopping the child's behavior, potentially contributing to those mutually coercive cycles of interaction.
So it can become a kind of escalating cycle where the child acts out, the parent responds negatively but without success, and the child's behavior then intensifies. Now, Patterson placed a lot of emphasis on negative reinforcement as a key mechanism driving these patterns. Can you explain how that works in the context of parent-child interactions and CD?
Certainly, negative reinforcement occurs when a behavior is strengthened because it leads to the removal or termination of something unpleasant.
Okay, removing the unpleasant thing.
Exactly. Think of it this way. If a mother keeps nagging her child to do their homework and the child throws a tantrum and refuses, the mother might eventually stop nagging, at least temporarily, to try and calm the situation down or just to get some peace. In that moment, the child's tantrum is negatively reinforced because it successfully stopped the nagging.
Okay, the nagging stopped.
Right. Similarly, the mother's act of giving in is also negatively reinforced because it stopped the child's tantrum. Patterson argued that these kinds of short-term relief for both parent and child can make these negative interaction patterns very resistant to change over time.
So, the child learns that by acting out, they can escape demands or unpleasant situations, and the parent learns that by giving in, they can immediately stop the child's aversive behavior. Did Patterson's research find direct evidence that this kind of negative reinforcement was happening more frequently or more effectively in families with conduct disorder?
Well, he looked at whether a child's aversive behavior was more likely to be preceded by annoying or intrusive behavior from other family members, with the idea that the child's negative behavior might be an attempt to escape or ward off those intrusions.
Okay.
While he did find that aversive behavior in both groups of families, those with and without CD, was preceded by another family member's aversive behavior in about one-third of the observed instances, the frequency with which mothers in CD families initiated these aversive behaviors was significantly higher.
So, mothers in CD families started the negativity more often.
That's what the data suggested, yes. This higher rate of negative initiations from mothers in CD families aligns with the idea that the child might be reacting to and being negatively reinforced by the termination of these maternal aversive behaviors.
But the paper also points out some methodological criticisms of Patterson's approach, particularly the use of broad categories of aversive behavior and the focus on analyzing only adjacent pairs of behaviors in the interaction sequence.
That's right. By grouping all negative behaviors together under this broad label of aversive, you can lose a lot of the nuance and specific dynamics of the conflict. For example, a mild verbal correction and an angry shout would both be coded as aversive.
Yeah, very different things.
Exactly. Additionally, by only looking at one behavior and the behavior that immediately follows it, you might miss the overall outcome and the longer-term dynamics of the interaction. For instance, even if a parent initially responds negatively to a child's misbehavior, they might eventually give in to the child's demands later in the interaction to stop the conflict, and this ultimate capitulation would still reinforce the child's problem behavior, even if it wasn't the immediately following event.
And this is where the research by Joan Gardner, focusing on parental capitulation, becomes particularly relevant, right?
Mm.
It takes a more focused look at how conflicts end.
Exactly. Gardner's research specifically investigated whether mothers of children with conduct disorder were more likely to give in to their child's demands or back down from their own requests during a conflict situation. Her studies found that mothers of preschoolers with CD were significantly more likely to fail to follow through on their initial demands to the child compared to mothers of children without CD.
They give in more often.
Yes. What was particularly telling was that this capitulation by the mother was even more likely to occur when the conflict had started with a parental demand, strongly suggesting that the child's persistent noncompliance and potentially escalating behavior was being negatively reinforced by the mother eventually giving up.
That seems to provide more direct support for the idea of negative reinforcement playing a significant role in families with CD, where the child learns that by resisting parental demands, they can often get the parent to eventually withdraw the demand. Now, the paper also introduces an alternative perspective on reinforcement in these families, the idea of indiscriminate caretaking. What's the core of that hypothesis?
Waller and Dumas propose that in families where children have CD, parents might exhibit a pattern of responding to their children in a very unpredictable way, sometimes even reacting negatively to appropriate or neutral behavior.
Unpredictable reaction.
Yes. Their hypothesis was that this unpredictability itself is aversive to the child, creating a sense of anxiety or unease. In such an environment, engaging in problem behavior might actually become a way for the child to elicit more predictable negative responses from the parent, thus being negatively reinforced by the reduction in unpredictability, even if the response is negative.
So in this model, the child acts out, not necessarily to escape a specific demand, but more to create a more predictable, even if it's versively predictable, reaction from the parent in an otherwise unpredictable environment.
Did research find evidence to support this idea of indiscriminate parenting in families with CD?
Yes, some earlier work by Patterson and Snyder did find that mothers of conduct disordered children showed more indiscriminate responses to their children's behavior, including exhibiting aversive reactions even to seemingly appropriate actions.
Okay, so there was some evidence. Yeah, and Snyder's statistical analysis of the sequences of interaction also suggested that maternal reactions were less predictable based on the child's prior behavior in CD families compared to families without these issues. Waller and Dumas' own sequential analyses of mother-child interactions found that the mother's behavior did become more predictably aversive, specifically during bursts of child problem behavior.
Ah, so the predictability increased during the problem behavior.
Right. They interpreted this finding as supporting the idea that the problem behavior was being reinforced by this increased predictability of the mother's negative response, even though they acknowledged that their study involved a small and somewhat unusual sample of depressed and socially isolated mothers.
It seems like there might be multiple reinforcement mechanisms at play in these complex family dynamics, and perhaps the dominant mechanism varies between families or even within the same family at different times. Now, the paper also makes a really important point that focusing solely on conflict and negative interactions might be neglecting a significant part of the picture, the positive parent-child interactions.
Exactly. While conflict is undoubtedly important, it actually makes up a relatively small percentage of the total interactions that occur in a day, even in families facing challenges with CD.
That's a good point. Most of the time is in conflict.
Right. The quality of the other, say 80% of the time, the moments of warmth, playfulness, responsiveness, and shared positive experiences could be just as, if not more, crucial in either preventing the development of problem behavior or helping to mitigate it once it emerges. Joint play, in particular, is often seen as a really valuable context for children to learn more harmonious and cooperative ways of interacting.
And the research seems to indicate that there's a connection between the amount of positive interaction, like joint play, and lower rates of behavior problems, even in children who aren't necessarily diagnosed with CD.
Yes, studies have found an inverse relationship between the frequency of joint play and the occurrence of non-clinical behavior problems in children. Gardner's research showed that preschoolers with CD spent significantly less time engaged in joint play and positive conversation with their mothers compared to children without CD.
Less positive interaction.
Yes, and they spent more of their time in solitary or less constructive activities. Pettit and Bates also found a correlation between higher levels of positive maternal involvement and lower ratings of problem behavior in children.
But again, as we've discussed before, correlation doesn't necessarily tell us about the direction of cause and effect. Did longitudinal studies offer any more insight into whether a lack of positive interaction early on might actually predict later behavior problems?
Yes, Pettit and Bates's longitudinal study provided some really compelling findings in this regard. They found that a lack of affectionate and what they termed educative interactions in the early years actually predicted higher levels of problem behavior by the time the children were 4 years old.
So, lack of positive predicted problems.
Exactly. Interestingly, early negative interactions did not show the same predictive power. This suggests that those early positive connections and shared experiences might be fundamentally important in shaping a child's later behavioral development. It's possible that the absence of these positive interactions in early life is a stronger predictor of later problems than the mere presence of early negativity.
That's a really powerful idea, highlighting the potential protective role of those early positive bonds.
Hmm.
What about the quality of that joint play? What are the elements that make it most beneficial for a child's development?
Well, high-quality joint play is thought to involve elements like mutual warmth and enjoyment between the parent and child, genuine shared interest in the activity, good cooperation, and the parent's ability to gently structure the play in a way that keeps it going and offers subtle guidance without being overly directive.
So being engaged and supportive.
Right. Research has also looked at who initiates these play episodes and how the other person responds. Pettit and Bates found that mothers of children with more severe behavior problems rarely initiated joint play activities themselves, even though these children actually made more positive attempts to engage their mothers in play.
So the kids were trying, but the moms weren't initiating.
That's what that study suggested. And Gardner's work supported this, finding that mothers of preschoolers with CD initiated fewer episodes of joint play, were less responsive to their children's suggestions during play, and also contributed fewer suggestions of their own.
It sounds like there might be a pattern of lower levels of engagement and responsiveness from mothers of children with CD, specifically during these opportunities for positive interaction. Could factors like maternal depression also be contributing to this lower play involvement?
It's certainly a possibility that maternal depression could play a role in a mother's reduced initiative and engagement in play. However, the research seems to suggest that the differences observed in families with CD might be more pronounced than what can be solely attributed to maternal depression.
So it's probably more complex than just depression.
It seems more likely that a combination of factors, including a potentially more challenging child temperament and the various stresses that can contribute to depression, create a complex web of challenges that affect both positive and negative interactions within the family.
And the paper also touches on the idea that maternal responsiveness, not just in terms of discipline, but also in these positive interactions, is really crucial for fostering child compliance and cooperation.
Yes, Parpel and McCoby suggested that a mother's willingness to be responsive to her child's reasonable requests and to clearly explain the reasons behind any refusals can be a key factor in promoting willing compliance in children, rather than just obedience based on fear of punishment.
Responding positively helps compliance.
That's the idea. They even conducted an experimental study where mothers were trained to be more responsive to their children during play sessions, and they found that these children showed greater compliance with the subsequent cleanup task. While this was an experimental setting and has its limitations in terms of generalizing to real life, it does offer some support for the idea that maternal responsiveness plays a causal role in child behavior.
This has been a truly in-depth exploration of a very complex area. To bring it all together, what are some of the key implications of this research, and what directions does the paper suggest for future work?
Well, the paper really reinforces the strong and consistent finding of multiple social and familial disadvantages being more common in the homes of children with conduct disorder. It emphasizes that parent-child interaction appears to be a critical pathway through which these broader social conditions can influence the development of CD.
Interaction is the pathway.
Yes. The work of Dumas and Waller reminds us that we need to look beyond just the immediate parent-child dyad and consider the impact of the wider social network on both parents and children. For interventions to be most effective, they might need to address not only the direct interactions between parent and child, but also focus on strengthening marital relationships and improving the parents' connections and support outside the family.
Broadening the focus of help.
Exactly. Dumas' earlier works specifically highlighted how specific negative extrafamilial interactions can impact parenting.
And the ongoing challenge of understanding cause and effect in this area remains a significant one, doesn't it?
Absolutely. While correlational studies provide valuable information about associations between different factors, ultimately, more longitudinal research that follows families over time, as well as well-designed experimental interventions, are needed to more definitively establish causal relationships.
Need more than just correlations.
Right. The fact that many intervention programs aimed at altering parent-child interaction have shown success provides strong evidence that this relationship is indeed causal, but more research is needed to pinpoint which specific elements of these interventions are the most effective and why.
Refining the interventions.
Precisely. The paper also reminds us that we need to be mindful of not just focusing on how parents influence children, but also on the significant ways that children can influence their parents. Some research suggests that in some cases, aversive interactions might be primarily driven by the child's difficult behavior.
The child effect again.
Yes. Finally, there's a clear call for future research to continue investigating both the conflictual and the positive aspects of family relationships. The early emergence of difficulties in parent-child interaction during play in children with CD suggests that this area and how to foster more positive engagement is particularly important for future research and therapeutic efforts.
Focusing on positive interaction seems key.
It does. One interesting suggestion mentioned in the paper is for a more cognitive theory that integrates ideas about attachment, parental perceptions, expectations, and attributions into our understanding of these dynamics.
So to summarize our deep dive, we've seen that conduct disorder is a multifaceted issue shaped by a complex interplay of social circumstances, creating a context of risk, a child's innate temperament influencing early interactions, and the moment-to-moment dynamics of parent-child interactions, both in times of conflict and in moments of connection, all playing a crucial role
Absolutely.
in the development and maintenance of these challenging behaviors. And while negative interactions have been a central focus of research, the evidence increasingly underscores the profound importance of positive interactions, especially in the early years of a child's life.
Precisely. And this leads to a really important question for you, our listener. Considering all this research on the power of early positive interactions, What small intentional shifts in your daily connections with children could potentially have the most significant and lasting positive impact on their overall well-being, regardless of whether there are any specific behavioral challenges present?
Yeah,
It's really worth taking a moment to reflect on the balance of interactions you observe or experience.
definitely gives you something to think about. If you're interested in exploring this topic further, we encourage you to seek out more resources on child development, effective parenting strategies, and the surprisingly powerful role of play in fostering healthy relationships. Thank you for joining us for this deep dive.